Good afternoon, everyone. Welcome to today's COVID-19 media availability with the Southern Nevada Health District. I'm Corey from the Office of Communications, and I'll be moderating today. If your camera is currently on, we ask you to please disable it at this time. To ask a question today, please use the raise hand feature located at the bottom of the participants list, or type your question into the chat box. If you're joining us by phone, press *9 in order to raise your hand. Thank you for your participation today. You have our permission to record the session. We are now ready to begin.
Good afternoon, and thank you for joining us today. I'm Dr. Michael Johnson, Director of Community Health at the Southern Nevada Health District. Let me begin today by just briefly sharing our latest numbers. Currently, the Southern Nevada Health District is reporting 3,891 confirmed cases of COVID-19 and unfortunately 196 deaths. However, we are estimating 2,507 people, or about 64%, have recovered from COVID-19 in Clark County. In addition, our hospital capacity is remaining stable, and our overall trends in case numbers appear to be plateauing. So our collective social distancing in our community appears to be working, which is very good news. I'm joined today by Dr. Kraushaar, our medical investigator, and Mr. Jeff Quinn, our manager of the Office of Public Health Preparedness. At this point, we'd like to open it up to questions now, and Corey Burgess will moderate.
Our first question today comes from the phone number ending in 2962. Go ahead.
Hi, it's Dana Gentry from the Nevada Current. On April 8th, the state put out a memo to a variety of organizations, including the coroner and health districts, about unreported deaths. Do you have any idea of how many unreported deaths we're talking about in Southern Nevada?
Whit, do you want to take that?
Sure. You know, death reporting is a challenge. I mean, so most of our cases are most of the deaths are reported by the hospitals and by healthcare providers. They're flagged as being related to COVID because laboratory testing usually happens in the hospital setting. Deaths that happen outside the hospital or prior to testing are more challenging to pick up. So cases like that are reported through the coroner's office or through review of death records. It's there's a lot of room for judgment, and so it can be difficult to tell exactly how many cases we may be missing. I can say that when we look at the trends of deaths at this time of year compared to the same time last year, we aren't seeing a large spike prior to this outbreak as they're seeing in other parts of the country. So even though we are probably missing some cases, I think our death records are fairly accurate at this time. Dr. Johnson, do you have anything else to say?
No, that's good. Thank you.
Okay, if anybody else has questions, please either type them into the chat box or use the raise hand feature, which is at the bottom of the participants list. Okay, we have a question now from Megan Messerly. Go ahead.
I wanted to ask for an update on contact tracing. I saw today that Quinn Resorts announced that they're going to be dedicating, it sounds like 70 of their call center staff to contact tracing. It was phrased as they're giving those folks to the Clark County Commission. I don't know if that really means they're going to the health district, but I was just wondering, how you all are doing in terms of securing any additional staff for contact tracing and sort of what our capacity is right now.
Sure. Well, I'll answer the first part and I'll let Jeff elaborate on that. But we have put in requests for additional staff to help with contact tracing because it's quite an undertaking. And so we should be receiving additional staff to help with this as well. The Wynn call center is also setting up a contact tracing effort, and our staff will be working with them closely on contact tracing as well. Jeff, you want to update on the rest of the things we're doing?
Yeah, so with the governor's call for volunteers through ServeNV, which is pretty much the one-stop shop for folks, all the possible volunteer opportunities in Nevada, the Battle-Born Reserve Corps, the Medical Reserve Corps, Southern Nevada. Really, those are the pools of applicants that we use generally to support the emergency response needs from the various divisions and departments. And when we do community outreach events, if we need additional medical personnel and if we need additional non-medical personnel, that's where we typically pull them from. We do have availability of some other resources in the state through this emergency with National Guard resources, but it really requires a different resource request to submit for National Guard resources, both medical and non-medical folks. So we generally handle that through, we submit resource requests through the city and county emergency operation centers to see if they can be filled locally. And then if they can't, they get pushed up to the state emergency operation center. And then that's typically where we fill those resource requests. Generally, when we get volunteers or people to be placed to assist with our operations, there's an onboarding process to train them, to get them with who they report to, and all the activities that we want them to do in service of COVID-19 response.
We're going to take a few questions from the chat box. First up is from Mary Hines. Can you please describe any plans for increasing testing?
Yes, hi, Mary. Yes, we're working with our jurisdictional and community partners to increase, as Jeff was just mentioning, not only our contact tracing, but also our community tracing. The Southern Nevada Health District will be focusing on hotspots based on our data and some of the geographic mapping that we've put together to target areas in our community that are at higher risk. That would include particular minority groups, would include individuals 65 and over, for example. And our approach will be, and has been, is to send strike teams out of individuals to conduct tests. In some, we'll also be targeting skilled nursing facilities. So in some cases, we may send out several individuals to work with a particular facility to do testing. In other cases, we may, for larger events, we'll use our mobile clinic to do strike team testing in various areas. And for even larger events, we'll be doing drive-through pods with various stations for this kind of testing. We're also, as I mentioned, working with our community partners very closely, and UMC and UNLV and several others in the community are also doing community-based testing and looking to increase their efforts. Currently, our lab is has a current capacity of about 6,000 tests. We're able to do about 300 tests a day. In our current lab, we hope to, in the next week or so, be able to increase our capacity to 400 tests per day, and that will help. Jeff, would you like to add something to that?
Yeah, so testing is an interesting thing across the country. All of our states, jurisdictions, working with our federal partners, state, local, tribal partners, are working to increase testing capacity that we have available to us. And really, when we approach Southern Nevada outreach and we talk about testing, really we're talking about community outreach for collection sites to collect samples that can be tested through multiple sources of labs, whether it be through the Southern Nevada Public Health Laboratory, through UMC's testing laboratory, as well as the Nevada State Public Health Laboratory, and then our commercial labs, Quest, LabCorp, CPL, and the like. But really, it's a coordinated approach through multiple levels. We have healthcare system testing that has been occurring and continues to go on. Then we have the targeted outreach that some of us do, working with community partners based on unmet needs, the strike teams, and then also our other healthcare providers that are offering testing at this time. So Southwest Medical and some of the like are all doing the testing, but all that testing is a cumulative, really, and we are. I mean, each week, the capacity that we have goes up, and we're planning in coordination through our Emergency Operations Center, the Multi-Agency Coordination Center, to really identify locations and that we can set up as collection points to be able to collect samples from all the communities in Southern Nevada so that we can get those samples tested.
Our next question comes from Alexander Zapata. He says, what is the status of PPE in Southern Nevada?
Jeff?
Well, we can always use more. And so, you know, as we've said from the beginning of this, I think, you know, right now we're not seeing quite the surge that we're seeing in the hospitals. So there seem to be managing patients fairly well. But it's in the downtime, it's still an opportunity for us to resupply. We can't know exactly what's going to happen in the future, but we have to be able to protect our healthcare providers, first responders, and the outreach teams that the health district has to support community response efforts. We did pretty much distribute out in Southern Nevada the PPE that we received through managed inventory or federal resources. We are still processing resource requests from providers that still need additional PPE. And we're monitoring and managing donations that we still continue to get from the general public, providers that are not currently providing service, and others. But as those resources and the PPE resources come in, we manage it based on the existing resource requests that we have in place, and we continue to fill those orders. But right now, I think we're doing pretty good. But you know, that could change in the coming weeks, and so we really need to be prepared to what sources we'll have, especially if we're doing a lot more community collection sites. Any of the first responders that are out there operating their sites will need the necessary PPE to be able to perform some of the testing collection processes.
That's right.
Oh, we've got a lot of questions to go through today. So our next one comes up from Ricardo Torres from the Las Vegas Sun. For the 14 people who have died outside of hospitals, how was their cause of death determined to be due to COVID-19? And what's the role of the Clark County Coroner's Office in the pandemic?
What, do you want to take that?
Sure. I can't comment on the specific cases, but deaths that happen outside of hospitals, we review their previous records. So, for example, certain individuals may have previous positive tests for COVID, may go to the hospital, may be discharged. So we'd be able to review those records. The coroner can also perform testing, and they can also perform an investigation. Sometimes we'll talk to family members as well. So we'll talk to contacts of the decedent, and it's possible that they may be the decedent may be a contact of a known case. So there's CSTE, the Council for State and Territorial Epidemiologists, put out a case definition for probable cases. So there are a variety of mechanisms that we can use to try and determine whether a death outside of a hospital could be related to COVID or not.
We have a question in chat. Hi, can you talk about your plans when we reopen the state? How will the health district be operating?
Well, we're working, closely with, of course, the governor's office as well as our community partners on needs and strategies for reopening. In fact, our environmental health staff are, as we speak, pulling together guidelines for the industry for how to sort of the how-tos on reopening. These, of course, will be done in concert with guidelines that will be coming out of Governor Sisolak's office. And once we have timelines and more details on that, that will be announced. But we're working very closely with them. A lot of the resorts, for example, have already taken the initiatives to establish plexiglass dividers and thermal temperature scanners and 6-foot separations and mask requirements and so on. But we'll be working with them very closely on this effort.
We have another question from Dana. Please go ahead.
Hi, we keep hearing about the increase in testing capacity, but why is it not showing up in the numbers week to week? I think on April 21st, we were told to look for a surge this past week, and it doesn't seem to have manifested yet.
Well, so, you know, it really comes down to supply. If it, you know, prior to doing any collection event that we host, and this is kind of separate from the healthcare system testing that's going on. I think that if we're able to see the numbers that were reported by those individuals being tested in the healthcare system, it would show that the testing that is occurring this week from last week would be higher. But I don't have the data necessary to support that assumption. Now, for us in talking about strike teams that we send out and deploy for targeted outreach events, the three pieces of information that we need to ensure that we have is enough collection kits. So we have to make sure that we have those available. We also have to have identified the lab that is actually going to do the testing for these tests, and that we have the personnel necessary to manage the volume of number of individuals that we go out to. If all those three are in place and we have those, then we can execute the collection site. If we don't have those, then really we're delayed until we get enough resources, supplies, manpower to actually complete the collection. But we don't want to have community collection sites set up where we're taking samples from individuals if we can't reasonably expect that they're going to be tested. There's a short turnaround time on a lot of the samples that and the testing protocols that we have, and really those samples aren't good after a certain period of time. So we have to do this kind of stop and start process of going out and collecting samples, having those tested, and then wait till we have more supplies to do that. Eventually, I think we will start to see that. We are already starting to see the private sector partners offering more clinics. So when Walmart gets a certain number of tests and collection kits and are able to offer that up to the community, it's a good thing. I mean, really, in the weeks coming up, I think we'll see more and more of that type of outreach, and our private partners as well as our public partners having testing available.
Yeah, and I would add that we're working closely with the commercial labs as well to move ourselves up on the priority list, if you will, to get access to testing supplies. Everyone, not only in the state of Nevada and Southern Nevada, but in the country, is competing for the same testing resources. And given the sheer volume that commercial labs such as LabCorp and Quest do, they oftentimes have priority in securing supplies. So we work very closely with them. So we're partners, and we can have that same priority.
Our next question comes from Ronia. Please go ahead.
Hello, this is Ronia from Fox 5. I actually have a couple of questions. First question is, with this being such a new virus, is there a database to monitor any infected individuals for any long-term damage? And the second question is, with resorts announcing, like Quinn announcing the thermal cameras, is there a possibility of also seeing the plexiglass at any resorts on the Las Vegas Strip?
Well, let me respond to your second question first, and then I'll ask Whit to respond to your first question. We have seen that certain resorts are looking to install plexiglass around gaming tables and between slot machines and so on. But that's really up to the resorts and their specific plans. As I mentioned a moment ago, as we work on our guidelines to help reopen Southern Nevada, including the resort industry, our guidelines will work very closely with the governor's guidelines for how to do that, and as well as with the resorts. And we'll make recommendations based on the governor's recommendations and CDC for how that should roll out. But plexiglass and thermal screeners are two of the things that I've heard quite a bit about in the resorts rolling out. Let me ask Dr. Kraushaar to respond to your first question.
So I'm not aware of any specific studies being done or any databases looking at sort of long-term or sort of tracking individual COVID-19 cases over a long period of time to monitor their clinical status or outcomes. The surveillance data that we're collecting now is something that we could use in the future to perform an analysis at a different time. I'm sure there are a lot of universities that are looking at this exact question, and they're probably enrolling people in studies trying to assess this, but that's not something that we're doing currently.
Yeah, I will add to that there are several universities that I'm aware of that are interested in doing this kind of COVID research, whether it's retrospective case reviews or other interesting research questions. And we even outside of COVID-19, the health district often will partner with academic institutions such as UNLV or UNR or even other Boston University, other universities on various research projects that we engage in. So somewhere down the line, we may partner with some of this. I do know that I've been getting various requests from folks, researchers on access to our data or bouncing research ideas off me and so on.
But it's an interesting question you pose about how things are going to change. Really, still the uniform and consistent messaging that the health district's putting out is still to continue to wash your hands, cover your cough when out in public, consider wearing a surgical mask, not necessarily to protect you from COVID, but to protect everybody. If you have mild symptoms or don't know that you're infected with COVID and you still could be, then you're just saving your fellow citizens around you. So it'll be interesting to see, because it's really not, it's a new normal for us. It is not going back to the pre-days of COVID. A lot of planning considerations will be implemented in every level of our resort property, how we manage our tourism industry and visitors, as well as our own personal behaviors, so that hopefully some of those good positive behaviors that we've learned during COVID, we can continue on indefinitely.
Megan Messerly wants to know, how many additional staff is the health district requesting to help with contact tracing?
Well, we currently have 54 trained disease investigators that are doing contact tracing, and we've requested a doubling of our staff, so another 54 at this point, to help with the as community testing is increased, to help with the increased demand on contact tracing. If we need more staff beyond that, depending on how many tests are being done in the community, we have other resources through our multi-agency coordinating center that we can tap into to help with that.
Ed Comenda from the Reno Gazette Journal is asking if you can identify the largest geographical hotspot in Southern Nevada.
Well, we, as you're probably aware from our website, we have city maps and zip code maps that are updated daily, if not every other day. And the largest city, of course, in Southern Nevada would be the city of Las Vegas. with the most cases, followed by, I believe, North Las Vegas, and then on down Henderson, probably Boulder City, Mesquite, and Laughlin, in that order. We also have zip code maps, and those identify the range of cases by zip code. So looking at those maps, one can see where the red are the hottest spots, or the highest number of cases, highest range of cases, where those might be. Some of those, of course, have been in North Las Vegas, where we've been doing some strike team work on testing.
Channel 8's Kristen Drummond asks, does the health district think the stay-at-home order should remain after this Friday if you're seeing an improvement in the number of cases?
Well, I know the governor is planning to come out on Thursday and provide more detail on the reopening of Nevada. And of course, we work very closely with the governor's office, so we'll be following the guidelines that he puts out. I think looking at our numbers, looking at the data, I think that, as I mentioned in my opening remarks, that we've seen some of the plateauing of the data. Hospital capacity is remaining stable, so there's some good indicators that social distancing and staying at home is working. The health district at this point really is, I think, advocating a very gradual reopening, so that we don't have a large rebound in the number of COVID cases by lifting the stay-at-home orders, or social distancing, or any of the interventions that are really working, by lifting those too soon. We're also concerned, as we've mentioned before, that this fall we are concerned that there could be another, particularly if we have a bad flu season, if we don't keep these social distancing measures in place and do this gradually, that we could have not only a rebound of COVID-19, but we could be handling a lot of increased influenza cases at the same time. So there's a lot of reasons, good reasons, based on our data and lessons learned here and around the world, that this should be a phased-in gradual process, as has been proposed.
Megan is asking, is there an estimate for how many tests are being collected in Southern Nevada each day between all those various sources and sites you mentioned, and how many you're hoping to ramp up to?
Jeff, you want to comment on that?
Yeah, so if when folks talk about their testing capacity, that's pretty much, we do 300, we have the capability to do 300 tests a day. And so really our daily collection that we can currently do is 300 tests that we can collect. So if we collect 300 tests and we send it over to our lab, they do 300 tests. And so really, that is kind of the procedure. We really have to have our finger on the pulse, monitoring what our testing supply is, as well as our collection kits that we have available, is the limiting factor right there. Right now, if we get more availability of collection kits, and I know that we are working with a lot of our thinking outside the box, working with our universities and college to have students prepare viral transport medium and building some of these collection kits for us. It really is helping out in the community effort to increase our capacity. So once we get more of those, and some of the viral transport medium meets the QT quality control standards, then we can utilize those and go out and do more collection.
Yeah, and I would just add that, collectively, that Jeff spoke very accurately about our Southern Nevada Public Health Labs capacity. Other partners in the community, like UNLV or UMC, for example, is looking to get to a goal of 10,000 tests a day by June 1st. So collectively, there will be a lot of increase in a lot of community testing, certainly happening this month of May.
And a lot of the testing is done in the hospital, in private providers' offices, or by appointment only events. So really, the visibility, you're not going to see that quite yet. But once we do have more capacity, and as I mentioned before about the public-private partnership is to have more of private businesses offering up testing to the community. And so I think once you see more of those type of events, then people will have a visual cue to see that there really is, with the increased capacity, more collecting going on and more testing in the population.
And we have a question again from Dana. Please go ahead.
Hi, can you tell me, with cases rising like about 100,000 a day globally and about 20,000 a day in the U.S., what assurances can you give Nevadans that their hard work and sacrifices will not be for naught when tourists start rolling in?
Well, I would say that Nevada's done some things very correctly and cautiously in handling this pandemic. I think under Governor Sisolak's leadership, he's put public health first. He's been taking and is taking an evidence-based approach, as we do, to see where we are with cases, where we are with deaths, where we are with recovered individuals, and so on. So I think the cautious approach, which has followed CDC guidelines, and the patience that the public in Nevada has shown in staying home, in being able to make the sacrifices that they've made and they're continuing to make, and practicing social distancing and wearing masks when they do go out to grocery stores or pharmacies in public, is actually really working. The more we stay the course, the sooner we can move into the various phases of reopening. And once we begin to see a downward trend in the cases that we're looking at, and we're able to increase and sustain our community testing and our contact tracing. The last thing we want to do is open too soon to put not only our residents at risk, but also any visitors that would come to our state. So we work very closely with community partners, as we were talking about, on strategies for reopening to keep environments safe and to continue to practice these new principles. It is a new normal. It will be a different way of kind of living day to day for a while. So I would just ask Nevadans to continue to be patient, and that we're doing everything we can to handle these cases and help with reopening of Nevada.
Dr. Johnson, I don't see any further questions at this time. Do you have any closing remarks for today?
We'd just like to thank you all for taking the time today for our update. We'll continue to provide these updates, likely weekly, to allow for key updates and questions. There'll likely be more information about community testing as that rolls out, and our contact tracing as well, and certainly on the reopening of Nevada once the governor comes out with some more specific guidelines. I'd also like to thank Dr. Kraushaar and Mr. Quinn for not only being part of this media availability, but these guys have been working their tails off, like a lot of my staff, and I'm lucky to work with such a talented group of people. So just want to let people know how hard the health district staff are working. So thank you.
Thank you. One last question just popped up in the chat. Where are we with antibody testing?
Well, we are currently, our Southern Nevada Public Health Lab is currently conducting validation studies on 2 different antibody tests. So we hope to have those validation studies done in the next week or so, and be up and running. So that will add to our testing capabilities in the community, in addition to the diagnostic tests of the nasopharyngeal swabs and the self-collection swabs. We'll be able to add antibody testing to that. Whit, would you like to add anything to that?
I think the only other thing I would add is there's still, I've said this in the previous calls we've had like this, but there's still sort of uncertainty across the country on on how we interpret some of these tests. You know, if some of these tests, you get an indication that maybe someone had an infection in the past. You don't really know how long ago in the past that was. And so it's not as simple as, you know, seeing the test result and saying, okay, you're immune to this virus. So there's still a lot of areas of uncertainty that we need to, as a you know, a public health field and with researchers, figure the answers to these questions.
Thanks.
Thank you everyone for attending today's event. If you have any further questions, please reach out directly to our Office of Communications. Have a safe and healthy week, everyone. Thank you.